So why is it important to treat PAD? Well, I think as we've talked about a number of times here, peripheral arterial disease, which is blockage of the arteries in the legs due to atherosclerosis, may be asymptomatic, at least with regard to the symptoms in the leg. However, and this is crucially important, this is an indicator that patients may have blockage in arteries elsewhere. So the classic thing is if somebody walks in and they're found to have blockage in leg arteries, even if they're asymptomatic, now they need an evaluation to make sure there's no underlying coronary artery disease and risk of heart attack, or blockage in neck artery and risk of stroke. And those patients need guideline-based appropriate medical therapy, which is really very often overlooked, not just to save the limb, but more importantly, to save a life. Obviously, as the blockages get more progressive, now those patients are at risk of developing pain when they exert or walk, which is called claudication, pain at rest, when you no longer have gravity assisting blood flow and you get pain, which wakes you up at night, or wounds and ulcerations or potential gangrene can result in limb loss. And those cases, clearly, it's extremely important to understand the effects of peripheral arterial disease, recognize this as peripheral arterial disease, counsel perhaps even your physician, that they need to evaluate for peripheral arterial disease to help explain the leg symptoms, and then see an endovascular specialist or a vascular specialist, such as we are here at American Endovascular and Amputation Prevention. My take-home lesson, particularly as you might get older, is that leg pain is not a normal part of getting older. Wounds are not a normal part of getting older. Very often this is due to atherosclerosis or peripheral arterial disease in the legs, and you need to see a vascular specialist.